The brain, a complex mystery organ that influences everything a person does, thinks, or feels. Life after a brain injury can feel just as mysterious and complex, trying to navigate services, experiencing potential isolation, different functioning, and much more. The rehabilitation process can impact the person as well as their supporters. It's often filled with ups, downs, and everything in between, all while the brain is relearning and making new connections within. Join us as the Brain Injury Association of North Carolina sits down with brain injury advocates to discuss a variety of topics surrounding life after brain injury. The more we understand the different aspects of services and effects of brain injury, the better we can help make connections within our community for individuals living with a brain injury. This is Making Connections. Today, we're going to talk about case management and brain injury. Hello and welcome to our video series talking about a variety of things related to brain injury, whether that's services or specific areas within brain injury that are just kind of important to know about. So here we have someone from NeuroCommunity Care, and I'll let her introduce herself and give us a little bit of what your experience with brain injury is.
Sure. Well, thank you for having me. Currently at NeuroCommunity Care, I'm a certified brain injury specialist, and I work with mostly veterans who have experienced the TBI and are working on reintegrating into their communities. Prior to that, I have experience working in the VA system, inpatient psychiatric settings, and the public school system. So I've worked with clients with brain injuries from multiple populations, veterans, geriatric patients, and children in all of those settings.
Excellent. Yeah, it sounds like you have a wide variety of experience when it comes to particularly that population. I mean, individuals that are veterans or previously, military population. Within the military population, there's always certain things that are specific to them that they might need in terms of, living and thriving in the community. So can you describe to us kind of what case management is and how it's used after brain injury?
Sure. So case managers work with clients and caregivers to help navigate their journey and facilitate resources after their injury. We work with clients to develop goals, access services, and provide advocacy. So case managers can provide assistance in adjusting to the new normal. Clients and their families may be dealing with several life changes after injury, and this can include loss of employment or income or other living arrangements. So we're really there, again, to help kind of facilitate those resources and help adjust to life after injury.
Excellent. And so how, there's specific maybe changes or, like you said, there's kind of like the new normal. So how does having a brain injury or working with someone with a brain injury kind of impact how case management process is? Are there different roles that a case manager has to kind of play when it comes to serving an individual with a brain injury?
Absolutely. In working with clients with brain injury, it's important to be aware that your client may have executive functioning deficits or communication impairments. So they may require different types of reminders or communication. For example, a text message to remind them of a meeting you have with them later that day. Or another example may be a case manager that I work with has programmed her picture into her client's phone contact. So that way, whenever she calls, her picture pops up and they're reminded of who she is. But pretty much every client and case is so unique and needs vary from case to case that there are many roles a case manager may play. Some clients may require more emotional support or advocacy, and in some cases, the case manager may be more of a support for a caregiver, like they may need referrals to a caregiver support group, or in some cases, a client may need some help navigating the VA system. So it just depends based on the client needs. At NCC, we really rely on each other's experiences and diverse backgrounds as case managers to provide us with different perspectives to approach each case. For example, some of our case managers have vast VA experience, which is really valuable. We also have folks with backgrounds in social work, speech pathology, OT, rec therapy, among other things. So we really rely on each other and our diverse experiences to help with that.
Absolutely. I think that everyone has kind of their own lens with which they see kind of the individual, with what they see the services, and having a whole group of people that have different type of lenses is really how you can provide that kind of comprehensive care and really connect with the individual and sort of things like that. I wonder, so you mentioned the new normal when it comes to brain injury because you're dealing with potential challenges with your executive functioning, your cognition, your communication. Is there a trend that you see in terms of a new normal specifically related to, veterans after brain injury? Do they have specific considerations that make it either more challenging or more difficult to connect to the service system?
Sure. For many of our veterans, having to depend on someone else, whether totally or partially, is in line with their military training or being part of a team. So it can be really difficult for the veteran having to accept the balance of teamwork after their injury is not always equal. So this can be hard to accept after their injury. And when your identity in the military was based on everyone doing their part to make the machine work. So this can create some feelings of inadequacy, which can introduce other emotional and mental health challenges for veterans.
Yeah, I think I've definitely seen where even the step of asking for help or getting help is a really, really difficult one for people, for veterans specifically. And it's a big step, and it's a step of strength, but I think a lot of people still kind of view it as that kind of like, it's showing weakness. So any type of support and encouragement that you can provide is definitely, key, especially in this population.
Absolutely.
Yeah. And so are there certain services or common services that are helpful to, most individuals to connect with? As you mentioned, everyone is so different. So I know that there's no, blanket kind of, step checklist for people, but is there anything that, is kind of like a go-to when it comes to supporting services in the community?
Sure. We would commonly refer definitely to the local brain injury association or other community organizations that focus on inclusion in the community, navigation of disability benefits, and in our case, the veteran benefit system, definitely a pervasive need that our clients have. If there's no family or support system, we may try to connect to groups, organizations, or even individuals that have a common interest as the client. For example, we have individuals who are interested in physical fitness, getting back in shape. So we may connect them to a local adaptive training gym, possibly a book club for someone who enjoys reading. Our clients have such diverse interests, so it's really about delving into those and seeing what supports we can find. So this is just really important in order to build social capital and expand our circle of people that they can trust and rely on for local and immediate assistance when needed.
Excellent. Yeah, you definitely touched on a lot of really key things. And one of them that I heard was about being almost, very person-centered. Whatever the person has interests in, whatever their kind of goals are, that's what kind of steers, what type of services are being recommended or being connected to. Is there any elaboration you can provide on, being able to connect that person-centered care and how it might impact, brain injury rehabilitation or connection to services?
Absolutely. So person-centered care is when the client takes an active role in their treatment and goal setting. They're active participants in determining their goals, and they play an important role in team meetings with us, the case managers. We need them to take an active role in the planning process. We want to know what they enjoy doing pre-injury and how we can accommodate them doing these or similar activities after injury. We definitely want to understand what the client needs to accomplish this. So again, we need their input. This approach can also help our clients kind of discover new interests through brainstorming during our care with the care team during the collaborative meetings that we have.
Yeah, it's good to know that it's really a team effort, and it's really kind of geared by the individual. You did mention that sometimes more brainstorming is needed. Some people don't necessarily know what they want or how to achieve it. Can you tell us how self-awareness maybe, which is often impacted after brain injury, might impact the ability to kind of set and achieve that goals? How does that partnership look like between the case manager and the individual living with the brain injury? How does that look like? And maybe also talking about if the family, that what role they might play.
Sure. So we want to make sure a goal is realistic and attainable. So it's important for the client to have some self-awareness of challenges that weren't present pre-injury. We do try to empower our clients by facilitating skills that promote increased independence. And as a result, this often creates a self-awareness of their injury, and that can create a bridge to help them overcome their challenges. So we may kind of simplify a goal or start with something really simple. For example, if a client has a goal to a long-term goal to run a race, run a 5K or whatever it may be, we may start with a goal of getting back into the gym and then just building on that, building up some physical fitness and some endurance. And we can also have backup plans to alter that if it's not achievable. So the family definitely plays a role in that because they're also adjusting to their awareness of what the client may or may not be able to do and adjusting to what's present now that may not have been present pre-injury.
Excellent. Yeah, I definitely see that the family are going through their own process, absolutely, after a brain injury, and also kind of learning how to support the person, how to empower them. And I think getting them kind of on the team and including them in any sort of goals that you're creating is really a good first step in being a partner in care. I wonder, kind of building on, self-awareness, kind of, I'm thinking about different additional challenges that might impact someone's connection to services. One of the things that I see most often are co-occurring conditions such as like substance misuse or mental health conditions such as like anxiety, depression, sometimes like, schizophrenia, or some things that really impact someone's ability to connect with others or be able to get engaged in the community. What, if any, impact do you see on any sort of co-occurring conditions in the people that you serve?
Sure. So it's definitely important to be aware of any kind of pre-existing conditions that may be there prior to the brain injury. We know that substance use disorder and mental health conditions are common comorbidities with TBI. And with substance abuse disorder, TBI can impact compliance with any treatment program. The client may have reduced awareness on impacts that use may have on their health or how it's impacting their daily life. It can also be really difficult to differentiate symptoms of mental health conditions versus those related to TBI. We mentioned working with veterans and how that can look a little different. PTSD, post-traumatic stress disorder, is very common in the veterans that we work with. And again, symptoms can be similar to those of TBI, and one can impact the other. So again, just really important to have awareness of that. And the bottom line is it's just important to explore and include mental health support in your team approach to care during case management.
Absolutely. I think, yeah, that's a really good point, is always, including it within the treatment plan, taking into consideration any sort of pre-existing conditions, and the fact that sometimes they're very difficult to kind of tease out in terms of, symptoms or affecting anything. So that kind of holistic, comprehensive care is going to be the only way to really connect people to the services.
Exactly.
Yeah. We talked about how substance misuse or mental health may impact the type of services. And you mentioned a little bit earlier about the VA benefits and how, navigating that system can be so challenging. Can you describe some of the, financial or services or support options for individuals with brain injury?
Sure. So some of the services we would encourage clients to access would be TBI waivers or state disability programs, which can vary from state to state. But definitely the VA system and veteran service organizations for our veteran population. So important. There's lots of involvement. We definitely try to include those folks on our team approach to care. But there may also be other various corporate initiatives for supporting people with disabilities of all kinds that we may try to tap into. So those are some of the common services that we may try to refer our clients to.
We'll be right back.
NeuroCommunity Care is an independent case management and community support provider specializing in community-based support services for persons with brain injuries and other neurological conditions. Our services are provided in the individual's home or community and are functionally based. This translates to real-life skill development, improved quality of life, and increased independence. If you would like information on how NeuroCommunity Care can support you or your loved one, reach out to 919-210-5142.
Excellent. Yeah, because it's definitely it's a very difficult system. I think it definitely wasn't made for, people with complex behavioral and medical needs, really to be able to identify and navigate really smoothly. It oftentimes takes a case manager, a care coordinator, or someone in that role to try and kind of figure out all the things, all the paperwork, every box to check. It's, can get really overwhelming for someone that's just trying to make it through the next day, or stuff like that. It's really overwhelming. Is there any feedback that you get from families or individuals trying to navigate the system? What type of feedback do you get from those individuals?
So like you said, it just can be challenging, as there can be multiple parties involved or services involved trying to support an individual, which is great because at the end of the day, you truly believe that everyone has the same goal. The end goal for this client is to provide support. So as case managers, coordinating those can be a challenge. What we hear from family members is they really value that support, value someone being an advocate on their behalf to maybe call and find out more information, or sometimes we have folks that we previously worked with that we can connect them to, or just have some further resources. So we really try to assist our clients in that way. Another bit of feedback that we hear is it's really difficult to identify payer sources for needed services, or services that have been denied by other insurances or resources, or services that aren't typically, like I said, covered by insurance. So finding those, doing research and reaching out on a client's behalf is a huge part of our job too.
Yeah, that is definitely one of the more challenging things, seeing that stuff like, cognitive rehabilitation is not necessarily something that can be like reimbursed, even though it's been shown to have, significant impact. So I'm hoping, that
for sure
some changes and stuff like that. I know that there's a lot of treatments that are kind of not geared toward veterans, but are out there that are more, alternative, I guess, in a way, or, typically fall into that category of being difficult to reimburse. I know one being like hyperbaric oxygen therapy or anything. Can you tell us a little bit more about any of those alternative treatments that come to mind, maybe that maybe you, or maybe a story that you connected someone with that, had a lot of success?
Sure. We've had, like you said, some clients complete hyperbaric oxygen therapy and have had really great results. I have a client I work with, he just completed it in February and was also already kind of seeing some improvement in his pain management and that kind of thing. Of course, it can vary for everybody. A lot of our clients also like to take advantage of equine therapy. It's amazing the support or the bonding that they feel with the animals. It's pretty incredible, the stories I hear about our veteran population, or really anyone with a brain injury, and that therapeutic bond they create with the animal. So those are two great ones that you mentioned. We also have clients who have had great success with music therapy, art therapy. I have one client who is a fantastic artist, and art therapy allows him to get some of those feelings out in a way that he's more comfortable on paper or whatever medium he chooses. So art therapy has been incredibly successful for him. So big fan of alternative therapies, and the success stories are ongoing, and we could probably talk for a long period of time about the successes we've had with those.
Oh, good. Yeah, I always love to hear those type of stories, because I think they're not something that is almost in the bread and butter when it comes to services you need to connect with. I think all services are really helpful in their own way, but it almost feels like they should be, especially if a person is interested in those type of different services and connecting that with them in some way. So it's good to hear that there's been success, and it sounds like it's all sort of just putting someone kind of out of their normal routine and situation, and also giving people an opportunity to express themselves in some way. We know that individuals with brain injury might not be able to communicate, verbally sometimes. Sometimes it's difficult to find the words. So whether it's connecting with an animal where you don't need to necessarily have a conversation, it's more nonverbal, or, the art therapy where you're, using your hands and expressing yourself creatively. So those are definitely some of my favorite ones that I like to look at the research at as well. So it's good to hear that.
Definitely. Yeah.
Yeah. We talked about what the most challenging aspects of working within the delivery system for families. Do you have any other kind of comments or thoughts, like as a case manager, before we kind of go into the, what you'd like to see change?
Yeah, for sure. Like we said, support services can be complicated to navigate, especially if it's the first time you're dealing with them on top of the other stressors that can happen after an injury occurs, especially with a constantly changing system, as it seems. That can be difficult to understand. I will say, again, at NeuroCommunity Care, we rely on each other's different experiences and backgrounds, and often collaborate, so we have the most up-to-date information. It's not uncommon for us to kind of send a blast email and say, hey, I have a client that's struggling with this or needs this. Does anyone have any ideas that you've had experience with? And we can collaborate, and someone can say, oh, hey, yes, I just talked to this contact person here, and they should be able to help you. So it really allows us to have the most up-to-date information and access to the best resources.
Excellent. Yeah, that communication is key. And I think a lot of times what makes navigating or just kind of connecting to the service delivery system in general is because that type of communication is really easy within an organization, but I feel like there's almost like a disconnect or between organizations. That's where you kind of lose that communication, and it can be really challenging for someone that's, you know, waiting for information, or, you know, having to retell their story over and over again to be able to connect to the services. So I think that can be challenging. What would you want kind of case management services to look like? If you could, you know, if it was a perfect world or anything like that, can you give them kind of like your bucket list for that?
Yeah, for sure. We've definitely been implementing more technology at NCC, especially in this time of COVID-19. We have been taking advantage of video conferencing and providing virtual services to our clients. So hopefully this will expand case management services and help both clients and case managers feel more connected. This is something we've had in place for a while, so it was a pretty easy transition for us. So just to build on that, this would also allow us to reach a large number of clients that traditionally may have been underserved due to limited or absent services, especially in rural areas. Help us connect with them. Also, hopefully we'll have more information regarding TBI treatment modalities and research, as well as, you know, recognition from our healthcare system about the support and value of the care case managers provide to our clients.
Yeah, you bring up a really good point when it comes to difficulty with like transportation in rural areas or anything like that. Can you elaborate any more on the type of maybe barriers that come with kind of connecting to the community, and maybe the, you know, yeah, I guess I'll leave it at that. Any other barriers that are really difficult for individuals with brain injury?
Sure. Well, we know that our clients that live in bigger cities or metro areas, there's more resources as far as medical care and treatment and agencies, and really even brain injury specific agencies in those areas. So there are challenges for those that live in more rural areas. It's more challenging, like I was talking about earlier, connecting to those social groups that they may be interested in. It's more challenging to find those groups that they could connect with to build social capital. So that's definitely a challenge we see of folks living in the more rural areas. So it definitely requires some more research and some more legwork. Again, it's where we rely on each other to see what kind of services we've tapped in before and what's available there.
Yeah, I think that is definitely going to be something that we see in our response to, you know, all the social distancing and everything that people have been doing, is the rise in the use of technology, and maybe, you know, having access to more people that weren't, you know, previously recognized or not necessarily connected to. So that's maybe one of the exciting things to come out of, you know, these difficult and changing times.
Absolutely.
Yeah. So what do you have any kind of words or comments for individuals that maybe are hesitant, or they don't really know how to get started with kind of looking up services or anything like that? Is there any words that you can give to them if they're maybe just starting out on their journey and they have maybe the hesitancy of difficulty finding help or anything like that?
Yeah, I would definitely say that's a difficult thing to jump into. Again, it's difficult to navigate different systems. I would definitely say reaching out to a brain injury specific group is a good place to start, and they have a good understanding of the needs. And like I said, that's a good place to start to kind of then branch out. And we do realize it is a difficult step to take, but at the end, our ultimate goal is to promote independence and help work towards those goals. And it can be scary in the beginning, and it can seem like a really daunting task. But like I said, we start where the client is and really take a look at what those needs are, and then go from there. So again, very client-centered, very client-driven. So I would really encourage someone to take that first step and really be a part of the process.
Excellent. And so, and I guess unless you have any additional thoughts or comments, I guess, you know, how can people get connected with NeuroCommunity Care? Give us a little, you know, I know we've talked a little bit about what you guys do, but how can we get connected?
For sure. Well, NeuroCommunity Care supports over 500 clients nationwide who have a brain injury, spinal cord injury, or other neurological conditions. We work to ensure successful transitions into the communities. So again, we assist clients in identifying individual goals and provide opportunities for them to practice and develop life skills after injury. And those can address the areas of health and wellness, physical and cognitive functioning, independent living, emotional regulation, recreation, and social and vocational development. So we accept new clients from direct inquiry or referral from physicians, attorneys, case managers, healthcare professionals, multiple sources. So if someone is interested in learning more about NeuroCommunity Care and our services, they can definitely call us at 919-210-5142, or definitely hop on our website. There's so much more information on there, and that's neurocc.com.
Excellent. And I know that you mentioned that you work specifically with veterans, but do you guys serve individuals with brain injury as well, depending on funding opportunity, or is it just veterans?
Absolutely. We serve private individuals as well as veterans. So they're, again, like you said, different funding sources. So absolutely.
Excellent, excellent. Well, I don't have any additional questions for you. I think you were able to give a really great picture of kind of case management, what that means for individuals, the complexities of, individuals with brain injury, particularly if they have any sort of additional comorbidities or have additional diagnoses that might complicate care, alternative treatments that might not necessarily be the, first thing you think of, but can really be sometimes the most impactful. And, just the challenges as well as, the hopes for future connection of services and connecting people for the future. So I appreciate your time and, thank you so much, Sarah.